coronavirus has tested the limits of health systems worldwide. The number of critically ill patients in need of intensive care and artificial respiration continues to rise. Not surprisingly, the production of approved high-tech ventilators has been ramped up to combat the pandemic. To stave off any shortages, makeshift solutions offer an alternative if needed. Intensive care units in Italy, Spain, and France are already over their respective capacities. To prevent such a scenario for Germany, the University of Constance has developed a chart-based system that shows the occupancy rate of hospital wards. It differentiates between 3 critical care categories: non-invasive, invasive, and ECMO ventilation. The tool also factors in short-term projections to prevent immediate overload. A German project team is developing a do-it-yourself ventilator from easily sourced components. The device is based on an ambu bag, where a mask is pressed over the patient's airway and air is forced into the lungs. The components are a self-inflating bag and face mask, some mechanical parts, simple sensors, and the breathing support mechanism with a hygienic cover. The electronic components are inexpensive and available in large quantities. While the mechanical parts can be 3D printed, there is no shortage of ambu bags in most hospitals. The assembly instructions and software will be released as open source. The eVent project of the Massachusetts Institute of Technology has also designed an emergency ventilator. Mechanical paddles squeeze the resuscitator bag. Air is directed through a tube, which is placed in the patient's airway and driven by a small motor. Scientists at the University Hospital in Leipzig, the University of Applied Science in Zwickau, and the Fraunhofer IWU developed a 3D printed emergency ventilation system in just 6 days. The more ventilators we have, the more lives we can save. Fighting COVID-19 together. A commitment that is shaping society and researchers all over the world today, uniting us to win the battle against this virus.